Good morning, Vita. Welcome to the podcast. I'm so excited to have you on this morning to chat.
Hi, good morning, Brittany. I'm so super excited. This was like my first podcast I listened to before Maya. I spied on
Yeah.
my Maya aisle. I've learned a lot from all of the interviews. I'm like, I can't believe I'm here. I'm so excited.
Oh my gosh, I'm so excited to have you on. It's been so cool just to watch your journey,
Thank
both
you.
personally and professionally, and just how you literally, the amount of people that you are helping that are suffering. And I'm sure they come to you and they're like, I've been to provider after provider after provider. And I love your personal story, which I'm going to actually have you start with because I feel like, especially when we're treating patients with such a complex thing like TMJD, having that personal journey to be able to share with them, I'm sure is really comforting. So let's have you just tell us a little bit about you, your background, how, your story and your journey through oral facial pain led you to myofunctional therapy and kind of where you're at today.
Of course. So my journey started when I was little. I had a lot of issues with sleep since I was little. I never slept well. I was a sleepwalker, a sleep talker. I had ADHD. I wasn't good in school. I was in speech until seventh grade. Like it was insane. No one even looked at my tongue tie or anything like that. And then I also, because of my father's side, genetically, I have laterals missing. And also had a lot of issues with my teeth, like too small of my mouth. My mouth was too small, too many teeth, baby teeth until I was 17. Because of that, I was like, I will go into dentistry to help myself to be able to have teeth because no one in my family had good set of teeth. And that's how I started on my journey into hygiene school. And I had orthodontics done by NYU from 2007. So I was like 17. They extracted my bottom premolars to match my upper jaw, which, because I didn't have laterals, they moved my canines instead of into place of laterals. That's the choice that they made at that time because they were like, your mouth is too small, you have no room, let's remove teeth. And that caused even worse sleep. And I had issues with sleep, but I wasn't paying attention to sleep after that because I started paying attention more to my jaw. Like I started having a jaw popping, jaw clicking right after extractions. It was like a year after. It was like about when I started be like 18 years old, I think. Headaches, severe migraines, jaw issues, jaw popping, jaw clicking. It was a minor jaw pain, like it started, and it was always my left side. And I talked to the orthodontist, I talked to dentists, and they were like, oh, it's normal. It's after the braces. This is normal. This is normal. So I didn't pay attention to it. And then in hygiene school, it would get like worse and worse because of the stress. There's a big
Mhm.
emotion
Right?
component
Nobody
behind
knows
it.
what we go through in
Yeah,
hygiene.
no one knows the stress. It was really, really tough. And I started having more issues. And all of my professors were like, your jaw is really bad. Your symptoms, your left joint. I had a beacon since I was 17, like right after braces. So I had braces 5.5 years and I graduated hygiene school and they took my braces off. So I was like 21 and a half when that happened, 21, 22. And I went into dentistry, like I went into working for dental offices. And my goal was to find TMJ specialists. I
Mhm.
worked since the beginning for 13 years of being a hygienist. My focus was work for TMJ specialist offices because they will help you.
Mhm.
And I got into one. The first thing they gave me was a night guard, and it caused severe pain, worse sleep, worse migraines. I removed that. I was like, I'm not doing that. They've done x-rays, CT scans on me, and they were like, try this appliance, try this appliance. I've tried almost every appliance out there, and it caused worse and worse pain and worse jaw locking to the point where dentists, like if I had a hole in my tooth, if I had a cavity, they were like, we're not touching her because my jaw would open lock every time I would be
Oh
in the
my
chair.
God.
My bite would change. I would never open more than one finger or two fingers. My muscles were spasming. And literally, there was one time I worked for this office, and it was like the last years before I got into Mayo. I had a hole in the tooth. Literally, I had a cavity, and the dentist was like, no one is touching her. Like, it's just no. And then until a new dentist came along, she didn't know my history. She did a filling, and everyone was like, "How did you do her filling?" And after, because they removed my laterals, I don't have a good bite. And I cannot lateralize because there's no laterals. And what I realized that later in my journey, after doing all the CT scans, all the panoramic x-rays and everything, talking to all these different TMJ doctors, they were like, it's your jaw joint, you have an issue with the jaw, you will need jaw surgery based on what we see and based on all of your symptoms. We can't help you. So we are
Mhm.
done here. And I kept searching and I kept changing doctors, offices I worked in, and learned more and more
Yeah.
until I got this device. So I cannot lateralize. I cannot move my jaw side to side because there's no laterals. I got this sleep device, and it's like a Pantera device I can show you. And
Mhm.
this device cost me, and I that was like after I even got into my functional therapy. I already knew my functional therapy. My jaw was out of pain. I had no pain. And I got this device that was provided by a dentist. And she's like, this is going to help you with your sleep apnea. And I was like, okay, that's great. And I slept 2 weeks, slept the best sleep of my life. No like pain, no sleep apnea. Like everything felt so good. And all of a sudden, I started to have a severe neck pain, choking, like here. I couldn't talk.
Oh my
And it
gosh.
was weird. And I was like, oh my God, I damaged my jaw joint. Something happened. And she was like, no, it's like the pain is different, Vita. Like your jaw was good. Like because of my functional therapy and everything I've done with it, she was like, your jaw was good. Like something else have happened. This is a nerve pain. And I was like, I never had trigeminal neuralgia because the only thing I knew was trigeminal neuralgia. And she's
Mhm.
like, let me take a look at your CT scans again. We went back to all of the histories I had, and she was like, you have Eagle syndrome. And I'm like, what is Eagle syndrome? I've been a hygienist for, at that time it was like 11 years. I was like, what is Eagle syndrome? And she's like, it's a calcified ligament and it can pinch your nerve. And this is what's happening. And mine is like the longest I've ever seen. I've seen patients, I've been to lectures, and I was like, oh my God, this is why I couldn't tolerate certain sleep appliances that moved my jaw side to side. And this is how I actually healed my orthodontic trauma, because if they did not remove my laterals, and I had egos since I was little, that's how, because I teach certain ego releases, like how to release a ego pain, like when the person gets a flare up. I learned when I was 14 years old on myself because I had a flare. My eagles, like I would have that like choking here, like a nerve pain, and I would like pull my ear and do certain releases, and it would go
So is
away.
that what the pain that is associated typically with Eagle syndrome is?
Yes, that's the pain. So it depends because I do a lot of research. I stopped.
Not you,
I
Vita.
actually no. I actually today I'm starting a new device and I'm super excited about it. I'm actually after this I'm going to a local dentist that I got her to do soma appliance, which I'm super excited. It took me 3 years to find someone who would be able to do it. So
That's
Dr.
fantastic.
De Cruz have trained her and I'm starting it now. So I'm super, super, super excited about it. But I've I love doing research because I treat, like I see patients, right? And they cannot go to different offices and try these different devices because each device, this device is $2,500.
Right.
And I have an option of doing it. I have an option of having Eagle syndrome, having hypermobility, having issues with my body, having like jaw issues, right? I have that joint that is damaged on my left side. I can try those devices, I can research them on myself and see what helps, what doesn't. So
Mhm.
I was like, that's what I'm gonna do. I'm gonna do those devices, see if they help or they cause more pain. And
Mhm.
that's how I found out about the Eagle syndrome. But I also do is I also try different tools as well. So I know my triggers and I'll talk about how people should know their triggers. Everyone who has TMD or any body pain, you need to know your triggers, either stress, emotions, follow the nervous system, habits, bad habits. You have to know the triggers because I know my triggers, and sometimes I would trigger my jaw pain or tinnitus because I also had tinnitus. I had jaw pain, tinnitus for 15 years, and
Oh
it's
my
gone for
God.
the last 4 years. Like I would have flare-ups on and off for like half an hour a day, and it was gone. And I had POTS and MCAS. I still have MCAS, which it's all that can be regulated. It's if you know the tools, and I'm not talking about surgeries. I don't take any medications. I
Mhm.
never had any surgeries done on my body. I just use more natural and certain other devices to help me to be stable. Because
Mhm.
jaw, if we talk about jaw, the three stages. So you have healthy jaw joints, right? You have disease and stable, which is this is me. I'm diseased. I know I have a damaged jaw joints, both sides. Left is worse than the right. And then you have diseased and unstable. And that's the patients I get. They're
Mhm.
diseased, they're unstable, they're in pain, they're flaring up, and then they need help. And to help them is not to get them right away in a night guard, which makes it way worse, or an orthotic or get them expansion or anything. To help them, you have to stabilize them first. And it doesn't
Mhm.
matter if they have EDS or hypermobility, you just have to get them out of pain, out of
Mhm.
fire, and then get them in orthotics or appliances or use something else to help them. But you can't just start it because you don't know the triggers. You can
Right.
put that orthotic in their mouth and you don't know what they do during the day. Like
Right.
this is why I had all these appliances and no one knew I was sleeping on my face with my hands under my pillow, moving my jaw to one side for like 6, 7 hours a night or 8. No one knew
Mhm.
I was a hand leader. Remember? So I took I don't know if anyone knows, but I took Brittany course. Like it was my introductory course,
Mhm. Mhm.
and I was watching because every client of mine was like, "Oh, Vita, you're so good with your exercises." I was like, "Oh my god!" You just remember, like I was struggling with. I had a tongue thrust.
Mhm.
I
Mhm.
couldn't even put my tongue on the roof of the mouth, and I went back to look at the videos, and I took snapshots of myself hand leaning on my left side. I was always doing this because in my head I was supporting and helping myself. I was kind of
Right.
like babying this jaw, like, right?
Mhm.
But what I was doing so much damage, more damage to it, more instability.
Mhm.
And the dentists don't know that. That's why
Right.
myofunctional therapy is so important because we can teach them how not just to have that proper tongue posture and proper swallowing, but we can teach them to quit those habits. I'm a nail biter. Look at my nails. Look how long they are. Like I'm not a nail
Beautiful.
biter
Yeah.
anymore.
Now, how do you get people to, because it's a lot of the people, like if you were to ask them, do you lean, like, do you lean? People might be like, no, I don't ever lean. And then, of course, now you're bringing it to their attention. So, how do you get people to kind of like start to understand their habits?
Yeah.
Because they probably don't all have themselves on record on a Zoom meeting to go back and watch this.
Um, I monitor them. My assessments are so interesting. I do record my assessments because I
Okay.
need to know and go back. And so, in case I don't miss something, I always
Yeah.
record my assessment sessions.
Mhm.
It's only if a person wants it for not to miss anything, but for
Right.
assessments, I always record because I can see their habits and I'm big on habits like facial
Mhm.
mannerism, breathing with the neck. So many people are breathing with their necks and engaging that SCM, the sternocleidomastoid muscle, which can do so much damage. We're not just talking about improper breathing. We are talking about that strong muscle pulling on their temporal bone and rotating their temporal bone and changing their bite. Like
Wow.
this is how serious it is. Like how
Mhm.
that SCM, that sternocleidomastoid muscle, how important it is in posture,
Mhm.
breathing, but also with the jaw. And that's why people get headaches and migraines and pain here, right? So I monitor them. I'm big on facial mannerism and I catch them. Like I would always talk with like, are you a hand leaner or a lip licker? And I have all this on my questionnaire that they fill before they see me, and then they do this during the call, and they're like, "No, I'm not." I was like, "Well, I actually caught you 3 times doing it." And guess what side you did it on? And they're like, "What side?" And I'm like, "Your weak side, your damaged side, because your body is trying to compensate, your body is trying to support it, and that's the best way it can support it." It's
Mhm.
just again going back to that emotional component on the jaw. Like it's not just the jaw, it's like the whole body works for it.
Mhm.
So it's super, super interesting. But they actually, after assessment, because usually during the assessment, during my consultation, they already sign up for my program. I have a program for all of my sleep cases and oral facial pain cases, and it's like 6 to 8 months program because they're more intense. But
Mhm.
they do get a guide with the posture guide. I'm big on posture, and I will guide them through it. It took me over a year to work on my posture, and until I worked on my breathing, I was able to change my posture. I
Can you
worked
kinda
like,
explain that a little bit, like how the breathing's kinda like a
yes.
precursor?
So if you think about breathing, so we as myofunctional therapists think about breathing is that forward head posture. We thinking about a person is has sleep apnea or issues like with the airway. Look how many people have airway issues in OMD, but they don't have any symptoms.
Mhm.
Like I would talk to my students in my course and I would share like webinars like on breathing on different, and everyone was like, oh my god, that interviewer, that person has so many issues with their, like they have tantras, they have all this. And I was like, yet they're breathing good and yet they don't have any symptoms because I know that person. It's because their nervous system is good. So what
Mm,
happens is our posture will go forward. Our posture will go like, so think about that fetal position. Think about like that baby. So what
mhm,
happens if your body, your nervous system in a fight or flight, and your breathing is dysregulated, right? You're hyperventilating, your shoulders go forward and you're in fetal position to protect yourself, to protect your body, to protect your organs. So if you're working on the posture without working on the breathing, you
mhm,
can't. And you can change the nervous system by using the breath work.
mhm,
Because once you work on the breath, right, once you change them, and it's not just all of the courses I took on myofunctional therapy, they all talk about this breathing exercise, the body blowers, all this, but there's a whole big thing on breathing. I took a recently, it changed my whole world. I recently took a breath course. It's functional and therapeutic breath work, and I recently graduated from it. Changed my whole life and perspective on breathing, because as a myofunctional therapist, doing for 4 years doing breath work, all of the exercises we were taught. And I took, just like every myofunctional therapist, I took so many courses, so many modalities, and I Don Buteyko. I've read Dr. Buteyko's books and I've listened to his lectures because I also speak Russian. So I was able to learn on it, but I still suffered with breathing. I still couldn't do the breathing. And it was because my diaphragm was so locked. And I was all, so I didn't even knew about it, like that our diaphragm has to move 360. So we need to, so we have to go up and down the diaphragm to the sides and then forward and back. And I was so locked on my left side. My diaphragm didn't move at all on my left side. I've seen a posture restorative physical therapist, which I love. They're my go-to, my first referral for every person who has orofacial pain. Anyone who has posture issues is posture restorative physical therapist. They will check your eyesight, your posture, your hips, your breathing, everything. I went to posture restorative physical therapist. I've seen a really good chiropractor. Nothing worked. I was like, something's blocked on my left side. I can't breathe. I can't let go. And it's until I took this course, he was like, there's an emotional component behind it. And we started to go deep into it and releasing the traumas that I
mhm.
had from my right arm trauma,
Wow.
which I was like, my right arm. And he's like, yeah, you have issues with your right arm because I had a dog bite and I had physical trauma, which
Mhm,
is like it's fine physically, right?
mhm,
But
mhm,
emotionally, because I was 12, I didn't heal that trauma. So
mhm.
when I talked to the PIPT and he massaged this hand, I went to chiropractor, he worked on this hand. I had a 4 hour release. I cried for 4 hours. I never cried this long in my car after those visits. And the next day I was able to breathe with my left diaphragm.
Wow.
Crazy.
Wow.
Who would even think about that? And we talk
Right.
about it and we teach our patients, be like, breathe with your belly, like inhale
Right.
and exhale. But we're not even thinking. And that's why when I do my assessments now, I was like, I want you to put the camera down and I want you to put your hands here and I want you to breathe in and out. And they're
Mhm.
doing this. And I was like, which side? And I know by looking at the posture and looking how they're sitting, right? So if you're sitting with the right shoulder more forward, your right side will be moving more than the left.
So like me right now, like I'm looking at my posture.
Yeah. You're so funny. So yeah, so you would put the hands here and you will notice how one side moving more than another. And you're like, what is happening? Like,
Mhm.
how is this even possible? So I started my breathing with my patients with a diaphragmatic massage. Like I start them to connect for them to understand what is breathing. Like we all talk
Mhm.
about breathing, we all teach exercises, but people don't even understand what is breathing. And sometimes like the cases I see are all complicated cases. Like I have students come to me and they're like, oh Vita, like this case. I was like, complicated cases, I'm your girl. Like easy cases, I was like, uh oh, just do this and that. I'm like, this is so boring. Like I've never done an easy case. Like all of 99 cases I had were severe cases. But I had people that come to me that had TMJ issues, right? Had hearing loss issues, tinnitus, and like that all caused them to have all of those hearing issues. And I started doing breath work with them, and I realized that I couldn't do breathing exercises. I couldn't do this party blower, the blow whistle. I couldn't do it with her because her nervous system was so unsafe. Like
Mhm.
she was so much in the fight or flight that every time she would put that party blower in her between her lips, like her body was freaking out. She was doing the exercise, but she wasn't safe. She
Mhm.
didn't like it. It was
Mhm.
forced to her. You can see how her neck muscles were tensing up, how her facial muscles were tensing up. So that's not a good an exercise for her. I can't do that exercise for her
Right. Now, how
because
do you get, because, talking about past emotional traumas can be very difficult for patients. So, like, how do you kind of like start these conversations? Is it something in like your initial paperwork that starts the conversation and then you continue it? Like, how do you kind of bring these? Because I feel like a lot of past lack traumas, people don't even realize they
yeah,
have, right? Like, I think I shared with you that I did somatic coaching when I was going through my miscarriages, not realizing that before I could even heal from my miscarriages, like I had all this other stuff that I had to heal from that I honestly thought I was fine from. Like I had acknowledged it in the past, but I never actually fully healed through it.
yeah, yeah. I look at for me it's a little bit easier because I actually had this question in my group last week in my course group. For me it's easy because I have that gift of reading people. I can read, I can see stuff. So for me
Mhm.
it's much easier, and I'm trying to learn how to teach that for other people to see, to
Mhm.
do. So I'm learning on that. There's a great book. I met this great doctor on one of the conferences I went to. It was a more holistic conference. I'm like 80% into holistic and 20% medical and dental. And he wrote, it's about like Chinese medicine on how to read faces. And there's a book, it's a really good book
Cool.
that I'm trying to get my students to get so they will be able to understand. So the book name is WTF, Why the
I love that.
by Dr. Todd Frisch. And he's amazing because what he does is he talks about faces. And
Mhm.
if you see, like a face has two different stories. So he talks about how to read a face. And the right side is, it's very interesting, a little bit confusing. The right side of the body is a male. So that's father, brother, husband. It's a male figure. Left side of the body is a female figure. But the right side of the face is the mother, and the side of the face is the father. This is why a lot of people get
Interesting.
confused.
Yeah, it's like
It's like
crisscross.
switched, yes.
Yeah.
And what he does is he teaches you how to read faces and be able to know if there's like trauma, and every wrinkle means something in the body.
Wow.
in Chinese medicine. So it's super, super interesting. And when I found out about it, I was like, great, now people can understand what I see. Because for me, I
Right.
had that since I was little. I was able to see
Mm-hmm.
it.
Mm-hmm.
Um, and if you don't have the book, if you're not versed in it, what you can do is what I do is I ask them, I do have like any physical, emotional trauma, and I talk to them about it. I tell them, so temporal, mandibular, jaw. So you have temporal bones, you have a mandible bone, and then the jaw, right? The joint itself. So under a temporal bone, there's an amygdala, and it's in the brain center. So it's our emotional center. All of the emotions are hidden there.
Mm-hmm.
This is why stress causes a lot of joy issues. This is why, and I'm big on psychosomatics, which is a study of
Mm-hmm.
um, which is a study of like a mind and everything that is happening in the body is a cause of
Mm-hmm.
everything starting here with the emotions and what have happened to the person, and that affects your physiological. Like for example, people have any tinnitus, hearing issues. Those are
Mm-hmm.
the people that at some point in their life or even now that have tinnitus issues, they don't want to hear something. They don't want to hear the bad news. They don't want to hear something happen. I have clients who were abused when they were little, and they were emotionally abused with words. So they wished that they would not be able to hear. And
Wow.
what happens is all of their life until like 20 is like, I don't want to hear this. I don't want to hear my mom. I don't want to hear my dad. And then
Mm-hmm.
when they're in like late 30s or 40s, they're starting to lose their hearing.
Wow. That's crazy.
And it goes deep. It even goes when a mother is pregnant with a child and
Mm-hmm.
says those things, it will affect the child hearing. It goes
Wow.
so deep. Like there's just so much out there and like what I'm learning. And with the jaw, it's aggression, like it's like whole resentment, aggression. You're unable to say something. So if you think about women, right? So TMD is more prevalent with women, and it's not just because of estrogen receptors we have in
Mm-hmm.
our jaw joint, but it's emotional because a lot of women hold and on and they cannot pronounce, they cannot say something. Like if you go to work and the boss has been mean to a person, right? And they're like, oh, I can't believe he said that. Like they don't set boundaries, right? And they do not say anything back. And what they're doing is they're betraying the body, because the
Mm-hmm.
body, the jaw wanted to move, the jaw wanted to say something, right? But they hold on onto it, right? And they started to tense it up and clench and grind, right, in that moment to release that tension, because they were not able to say it, or they were not able to say it to a significant other, or like
Mm-hmm.
it's very common with women. Also, this is why there's a lot of thyroid issues with women versus men. And this is why my first homework I always give
Mm-hmm.
is singing or humming. There's two different, like singing is for people if I see anything on thyroid in their history, or if
Mm-hmm.
I can hear that they're not that, like I'm a loud person. I talk loud, like you will hear me miles away. But there are a lot of women, they're so quiet, like they talk
Mm-hmm.
so quietly because at some point someone told them so.
Mm-hmm.
They were not allowed to speak, right? So there will be the people that, the clients that I will be like, you have to sing 15 minutes a day. And
Wow.
then if they have hearing issues or they have sinus issues or they have congestion, they're humming 15 minutes a day. That
Mm-hmm.
exercise, always, that I give them during my assessment. I was like, you have this homework to do, you have to do this. And I have like by first session, I see them, this big difference
Can you
in
talk about that connect just for the listeners that might not know, like what you're trying to achieve with the humming?
the humming. So there's research. So it's so interesting because I also have like this different nasal rinses, the sonu, like all this like different devices you can do. There's research that came out that 15 minutes a day of humming will increase your nitric oxide. Like you don't need to use those nasal rinses to increase your, because their nasal rinses be like, we will increase your nitric oxide by this and this. Just do the humming.
Mhm.
Like
It's
it will
free.
increase.
It's
Well,
easy.
yeah, it's super easy. And you taught us in the course the nasal sticks. I love the nasal sticks.
Hmm.
And
Hmm.
I use the nasal sticks. I use essential oils to help me open up the nasal passages. If your listeners are using essential oils, it has to be like either Young Living or doTERRA. I love Young Living and doTERRA oils. I have each condition has its own like oil that I
Yes.
use. I
Okay.
use oils. I give oils in all of my kits. Again, it's only doTERRA oils, and it depends what they need. If they need nervous system regulation, if they need breathing, if they have jaw pain, if they have ear issues, if they have spine issues, because I do look at their C1, C2, C3, C4. So I look at their cervical cerebral instability. I always get that confused. So I look at the cervical instability because that plays a big role. So on our evaluation forms, on our assessments, we have to talk about that. We have to talk about trauma. And so, like, for example, Eagle syndrome, I had patients that would get sleep devices with the local dentist that I loved. And they were like, all of a sudden, they have pain. And it was like, I'm not sure if it's a jaw pain or not. And they were like, okay. And I was like, have you ever had any trauma? Have you ever had like a whiplash? Have you ever had a car accident? And they were like, yes, I did. In like 1970, I had a car accident. So they forgot about, they didn't tell that to the dentist, but it means there's big importance of knowing if there was any accidents or not, because Eagle syndrome is a lot of cases are caused by trauma. So if there was a hit to the head, right?
Mm.
And I had that when I was little, and also birth trauma can cause it too. And there are some cases that they say tonsil removal. I haven't seen many, but it was so interesting. You have to talk, like, go deep into a whole history and tell the doctor everything, because I even have like complicated cases and they haven't even told the doctor the whole story. I was like, you missed out this big portion of your life that is super important. Like
Mm.
any hit, like even any falls, even from a monkey bar, is so important, because if they hit
Right.
your face, if they hit that side of the jaw stops the proper growth. They
Mhm.
always will have inflammation there in that joint. And that's when we look at the x-rays and we can see that big asymmetry in their
Right.
faces. And that's from trauma. And I will have students send me cases and I'm like, they had trauma. No, they said there's no trauma. I was like, I want you to dig deep. They had trauma. Like, we have to find where the trauma was and what it was, and we can go from there. So it's super, super interesting.
And it's interesting too, like kind of how you just said, like the patient keeps saying no. Like, I don't think this was a patient I treated. I think it was actually one of my team members treated this case who there you just to your point, like you just know that there's something that they're missing, that they're not that they're not being honest about, that they're maybe not recalling, I don't know.
Yeah,
And time after time we would ask, like, any trauma, did you fall, were you hit, were you in a car accident, da, 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 da. I think it was like halfway through the program where finally the woman was like, you know what? She was like, yeah. She's like, when I was in college, like I ran into a door. Like I think it was one of those like revolving doors or something, and she ran right into it on her jaw. And she's like, I don't know. She's like, I don't think I've thought about that from the day that it happened. And this was probably like a decade ago at this point when she was, like in treatment. But so interesting that, like, you kind of, I guess the point I'm trying to get to is you kind of have to keep revisiting these
yeah,
things when you have a feeling that something's going on, because they might be blocking it for a reason, or they might just simply be forgetting because they think it's so minimal. Like, oh, she doesn't need to know that I fell, somebody elbowed me in the jaw when I was 5 years old and I lost my tooth or something. You know what I mean?
yeah. What I do, either during assessment or my first sessions, I talk to them about the amygdala, the emotional center, right? And I talk to them how important emotions are. And I
Hmm.
tell them, I was like, I know what the major thing about any oral facial pain, if they had it more than 6 months, it's chronic. They get that chronic pain and they have trauma there.
Hmm.
To me, it's a post-traumatic stress disorder for me. Like, every
Right.
time I walk into a dental office and I've been 4 years pain free, I get a panic attack,
I'm
because
sure.
I know if I'm getting in the chair, my jaw is panicking.
Hmm.
So we have to understand that. And I talk to them about that. I'm like, I understand.
Hmm.
I understand what you've been going through, right? As a person who also had jaw pain, right?
Right.
I understand what you've been going through, and I will teach them on the emotional component of it, and how we have to take care of that jaw, kind of baby it. When I go into a dental office, if you ever see me in a dental chair before I get a cleaning or a filling, I need 5 minutes to talk to my jaw. I put
Yeah.
hands on my jaw and I'm like, we worked so hard on you. You're safe. This is not going to hurt like it hurt 4 years ago. Yes, the bite will be off. Yes, you may have popping and clicking after this visit, right? But you're not going to suffer for 2 weeks to 2 months and be like opening, like I had closed locks, open locks. I had masseter spasming. When you would
Mhm.
look at my face, this cheek was like spasming for like a
Wow.
week. It was like so much pain. And I was like, and I talked to my Joanna and be like, you'll be fine. You're safe. We
Mhm.
know what to do if anything happens.
Mhm.
And that's what I
Mhm.
teach my clients from visit one. I was like, I will teach you tricks and I'll give you the tools. So if the flare up happens,
Mhm.
one, you will know what triggered it and
Mhm.
then you will prevent it in the future.
Mhm.
Two, you will know how to react to it and you have the tools now to
Mhm.
protect yourself, to protect the jaw, to baby it, right?
Mhm.
And then three, it will stop happening again because you have the tools, you know what to do. And that's the importance of having clients with oral facial pain is to teach them that. Because if
Mhm.
we don't teach them that, if we just teach them exercises, right? Just go by exercise by exercise by exercise, what we know will help them. And if they get a flare up, they will lose trust into Maya. And that
Right.
was me. Remember,
Mhm.
like I was doing exercises and I was like, this doesn't work. This is not good for me. This is not good for me. And thankfully I was listening to my body and I was like, what should I do to help me do this exercise but not have pain? And that's what I
Mhm.
did. So if you
Mhm.
have to do the program slower, do it slower, less
Mhm.
repetitions, because we have this 2 minutes. We
Mhm.
have this. I never do any exercises 2 minutes unless it's a breathing exercise or
Mhm.
posture. But my exercises are 30 seconds top 1 minute, never more.
Mhm.
And
Mhm.
I break them down. I'd be like, do it 10 times. Do it like see how you feel, like 10 clicks or 5 clicks. And I give them an option because a lot of people, especially women with jaw issues, they tend to be more perfectionist and they're like, I will do this exercise no matter what it takes. And I'm like, no, no, we don't look at that. It's more about how you do it and how your body is, like if your neck is engaging, if your muscles are engaging versus the repetition. I don't want perfection. I want progress, right? I
Right.
want you to be able to get from pain to pain free. And I'm
Mhm.
able to usually do it by session 4 is a big difference because
Wow.
my first couple sessions, I'm not big focus on myo exercises. It's more about posture, breathing, nervous system, and as well as sleep habits. Of course, we talk about all that. And myofascial release, getting them out of pain, giving them the tools to get out of pain so I can progress with the myo. I can
Mhm.
start myo. Because if I start myofunctional therapy exercises right from the beginning, they get pain, that's it, they're gone. And this
Right.
is how
Oh my
I
God.
get those cases from other myofunctional therapists. They will come to me and be like, oh, I did 4 sessions for Mayo and I got severe pain. And then I went to my dentist and was like, I'm never doing Mayo again. And the dentist was like, you should try this girl. And that's how I got that person. Um,
Mhm.
it's also, it's the understanding. I see that a lot of my functional therapists who had TMD themselves or any orofacial pain, there's a bigger of understanding. That's why
Oh
in my
yeah.
course, when I was it last year? Yes, end of or maybe January. This January, I have MCAS and POTS, and I went to conference and I was exposed to mold. And mold for me is like the worst thing ever. So I was sick for a whole month with POTS. And because I was sick for a whole month with POTS, I knew that because I haven't had tinnitus for 4 years and I could never
Wow.
trigger it
Mhm.
to try this new unit I got. I know I'm the worst. And I was like, I have thoughts. My body is so dysregulated, I can trigger my tinnitus. So I triggered my tinnitus. And I had tinnitus for like a week and a half. Never again. I was done. This was like last time I would ever do that because you forget the pain.
Right.
And when the pain comes back, and that's the big issue with orofacial pain, especially trigeminal neuralgia or TMD, is when the pain comes back, it's worse. It's
Mhm.
way worse. And it's not worse because the pain is worse. It's worse psychologically because you haven't had pain for 4 years. You had chronic pain for 15 years, you're fine, you get used to it. Your body get used to it. You're in survival mode. Like you're
Mhm.
still functioning even though you're in pain. But if someone remove that pain for a short period of time or even long time, right? And then it comes back psychologically,
Right.
it damages you. Like your
Mhm.
whole body is like, oh my God, I will never be able to get rid of it again.
Mhm.
And I will go back to those 15 years of chronic pain. How will I survive this?
Right.
And I was like panicking, nothing worked. And then that device I was using and all of the techniques I had worked. And
Oh, what device was it? I'm sorry.
um oh, I have it in my living room, but it's a cranium electrical stimulant, CES. It has to be, it's a prescription. And I've
Okay.
used that device with my naturopath back in 2017 for POTS. So it's a Soviet Union device that was invented in 1954. And in America, they have it for 55 years. And it helps. And I'll send you the link so you can
Yeah.
maybe post it
Perfect.
here. But for the last 50, 55 years, this company that made this device in the United States, it's FDA approved for anxiety and sleep, and it also helps with TMD and tinnitus. So it's a cranium electrical stimulant. It's not a tense unit. It's not. It's different.
Okay.
Tense units are a little bit different. I do have some people who use tense unit and they swear by it. Again, it depends on every person.
Right.
um, Red light therapy is great too, right? But it's again every person. I cannot do red light therapy. I cannot do sono. I can. Like
Interesting.
because
Okay.
you I always say I had a conversation last week with one of my patients and it was like off topic and because I talk a lot about nervous system and
Mhm.
she had this relationship with her ex still like she had a new boyfriend and she got an ex and I was like follow your nervous system because she
Mhm.
wasn't sure what to do and I was like follow your nervous system, your body will tell you what to do, your body will
Incredible.
tell you because if your
Mhm.
heart rate is raising, right?
Mhm.
If you feeling like this baby position, that fetal position, if your posture is changing, if your breathing is changing, this is not right for you.
You know, it's so funny you say that because so my husband, you know, Kyle, he is the nicest person you'll ever meet in the entire universe. And so, unfortunately, in the past, you know, he's had his heart broken and, you know, he would always hear from, you know, past girlfriends, whatever, that like they should have chose him, he was the safer option, blah 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 blah. And when we got together, I would constantly say to him, you know, we would be like, "What's your favorite thing about me?" type of thing. I'm like, "I feel so safe with you." And
Yes,
he didn't take it the way I meant it. He would take it as I meant, like, oh, I know that, like, he's never going to break my heart because he's a good guy, right? No,
yes,
that's not what I meant. Like, my body, because I have
yes,
been in the shittiest of shit
yes,
relationships before him.
yes,
I have never felt so calm and so regulated and just so I totally get what you're saying, that feeling, like
yes,
that tense fetal position, because in
yeah.
every other relationship I've been in my entire life, that was me, instant tense anytime I was in the room with the person.
Yes, that's the red flag. And this is why I have a book, Boundaries, and I have a book, It's Not You. So,
Mhm.
boundaries, it's all about boundaries. And then It's Not You, it's about narcissistic people in your life. By
Narcissist.
Dr. Ramadi, the best book. And those two books, it depends on the person I see or
Mhm,
even my students, I recommend to read. It depends. And I can tell, I can see that they have issues with this. And I was like, you have to read those two books.
mhm,
They changed my life.
mhm.
I read Boundaries every time someone crosses my boundaries. I read the book 4 times from cover to cover,
I
and I
love it.
listened to it one time on audiobook. Like if someone crosses the boundary of mine and I let them, I go back and read the book.
Mhm.
If they
And
do it
that's the
again, I
thing
go
with
back and
this
read the
stuff.
book.
Like, it is kind of continual work. It's something you have to continually work on. It's to your point. You don't just, you know, do it once, or you don't just, you have to revisit these things
Yes,
when something is triggering you to act a different way, right?
exactly.
So I want to talk a little bit about because I feel like a lot of myofunctional therapists and you know, they're treating these TMD cases and they'll come and they'll be like, okay, I'm at session 6 and like, you know, the patient's jaw is still clicking and popping. So can you explain, well, one, can you explain what is actually happening with the clicking and popping for maybe listeners that are listening that are patients that literally have clicking and popping, like what exactly is going on, and how you healed your clicking and popping through myo. Like, how is myo helpful for that? And I guess really the point I'm getting at is like how you have to do myo differently. It's not when you're working with TMD patients, you can't go by this cookie cutter, like we give this, and you mentioned this before, we give this exercise 15 repetitions, we give this exercise for 2 minutes. So talk a little bit about that.
So clicking and popping, let's start with that. And I was that person that had a deflection. So you have a deviation. Deviation is when the jaw kind of goes like a Z, like a zigzag, like it kind
Mhm,
of goes like side to side and comes back. Deflection is when the jaw goes to one side and like kind of goes this way. So it's like one-sided. Deflection is always worse than the deviation. Deflection is usually from trauma. Deflection is usually a sign that there's something going on with the joint itself. And the deviation is more muscular. But
mhm,
saying that, a lot of jaw cases, like 80% of jaw cases, is mostly muscular. Even though they may have a joint issue, it's
mhm,
always the muscle that causes the issue, right?
mhm,
Most of the time, it's the muscle, right? Yes, there are cases that have like degenerative joints or arthritis
mhm,
or idiopathic condyle resorption, right? So um, if we can treat the muscle, if we can teach the muscle, and that's the job of my functional therapist, to teach the muscle how to teach a person how to use this muscle properly for them versus against them, because everyone is walking around and they're using their muscles improperly, and this is why they're getting the muscle pains issues and jaw clicking and popping. So the jaw click and popping is when the disc gets out of place. And most of the cases, it's like they call it anterior disc displacement with reduction. And that's better to have that without the reduction, because that is like more complicated cases. And most of those cases have either like a disc issue, right? Or disc proliferation. Again, that's like a worst cases is more surgery cases.
mhm,
But most of the time they have the disc coming forward. And there are researches that say that you can put that disc back in place if they had it. I think the research said if it was like under 2 or 3 years, you can put that disc back with the certain exercises and stabilizing the muscles of the face, head, and neck, right? So you can get that popping and clicking to stop. My popping and clicking stopped. I haven't had a popping and clicking. And again, I had it for a very long time. I don't remember, like, again, it started like what, when I was 17, 18. And I don't
mhm,
remember if I had it like every day or not. It's hard for me to say. Between like 2015 to 2000 to 2020, I had it every day for sure, because those were
mhm,
like my worst jaw
mhm,
issues. And what happens is with the clicking and popping, the biggest thing that helped me was stop mouth breathing. We don't
mhm,
realize, and the posture, because of course if you mouth breathing, what happens is your jaw kind of goes forward, right? And you like this, and then your posture goes forward. So if your posture goes forward by gravity, your jaw goes forward, and the lateral pterygoid is firing 24/7, which is
mhm,
not supposed to be happening. And it can pull on the jaw, right? It can pull it more forward, and it can affect the disc, and they
mhm,
can have that pain, and they can also have that popping and clicking. So if you retrain them from mouth breathing to nasal breathing, and again, I'm 32 millimeter wide, but before my functional therapy, I was 30 and a half. Like I
mhm,
expanded my jaw just with my myo exercises and the tongue exercises to get that tongue on the roof of the mouth. My tongue has no room, and I still have that tongue tie, but
mhm,
yet I'm able to breathe during the day for sure with my
mhm,
nose. Even when
mhm,
I exercise, I use my nadi sticks, I use my breathe right nasal strips. That's the only thing that I'm able to use because of sensory issues I have. And that's how I function. And I don't care if people see me with that like nasal, like breathe dilator, like I don't
mhm,
care. Like I'm
mhm,
breathing, I'm getting
mhm,
proper breath. And
mhm,
you can educate yourself on proper nasal breathing during the day, at least, even though
mhm.
like with that case that needs expansion and it needs something to happen because they have sleep apnea. But at least during the day,
Right.
you're functioning properly, and you can get your nervous system more regulated by it. Because if we are mouth
Mhm,
breathing, that's it, you're in fight or flight. That's
mhm,
sympathetic nervous
mhm,
system activated. There's
mhm,
no way a person who's a mouth breather has is more in parasympathetic. We need both to function, but it has to be regulated, right? So
Mhm.
it affects the whole body. Of course, the
Mhm.
jaw will hurt. Of course, the disc,
Right.
something will happen with the disc because the body, the nervous system is in fight or flight. And if you don't, for me, the biggest thing is nervous system. I'm big
Mhm.
on nervous system. If you
Mhm.
cannot, this is as we talked about in the beginning, you can see people who are so dysfunctional, like they have horrible bites, horrible crowd. And we saw it in hygiene chair. And I would look at those people and be like, how do you not have jaw pain? Like
Right.
looking at my mom, like she has jaw issues the same as I have. She's like same history, everything the same, no pain, no issues. Yes, she's popping, clicking, no issues. She
Mhm.
never had issues with her jaw, just popping, clicking.
Wow.
That's it. No jaw pain, nothing. And I look at my scan and I'm like, how is that fair that I got pain from age 20? My mom is in her like almost 60, never had a pain, never
Right.
had pain. And it's the same anatomy, like you can see
Mhm.
it,
Mhm.
right? And it's like, it's insane. It's because what we are exposed to. Our parents, our
Right.
grandparents never had what we have now in our society. Then they didn't have phones. They didn't have social media, which is
Mhm.
horrible to do before bed and in the morning when you wake up. They didn't have all the stimuli. They
Right.
didn't have that much exposure to chemicals. They didn't, their nervous system was more regulated. Mothers had more help with their kids. There's a reason why I also get a lot of new moms. It's not just
Mhm.
hormones. Everyone is like, oh, it's your hormones. It's your hormones. It's not. They need help.
Mhm.
Like
Mhm.
before, to raise a child, it took a village. Now it's
Right.
one person and a dad. That's it.
Mhm.
Like it's impossible.
Amen to that.
I know. I'm like thinking about you and you have twins. Like like I just survived a weekend with my sister and her kids and I'm like I need a couple months to recover. Like my nervous system is not ready for that visit ever like
Oh
again.
my gosh, that is so funny. That is so funny. Um, one more question that I have too, because I'm sure you get this a lot from not only your students, but also the clients that you see, things they've tried in the past. Can you talk a little bit about Botox and your stance on Botox? And if how long do you wait? If somebody say came to you and they just got Botox last month or something, do you wait to start Myo? Like talk a little bit about that.
Um I've had many clients that had it done. Yeah,
Hmm.
it's their choice. I'm against it because of the chemicals in it. And what
Hmm.
it does, it kills the muscle slowly.
Hmm.
And the heavy metals it has in it, like a person who wants to do it has to be really, really careful and they need to know their body. Like if I know if I would ever do that for pain, it would not react well with me.
Hmm.
I know that I would have severe reactions from it. So
Hmm.
a person needs to know their body. I've heard good stories about it, like they had that relief. The problem is when it wears off, it's worse, and they have to
Hmm.
go back for more.
Hmm.
Usually after a third time, there's not much effect after. You
Mhm.
keep doing it, and there's no effect because
Right.
the root cause wasn't fixed.
Mhm.
And the root cause is their habits, how they swallow. So many people are even unaware how to swallow. I didn't even know. I like we swallow 2,000 to 2,500 times a day. And if you swallow incorrectly, your jaw moves every time that you
Mhm.
swallow. And we are just talking about saliva. We're not talking about like drinking or eating.
Right,
So you're
right.
putting that extra load on your jaw, and your jaw keeps like moving, right?
Mhm.
And hitting that if the disc is misplaced, right? So it either hits the back or the front, right? And it can damage the joint and we don't even think about it, right? Or if they have bad habits, like again sleeping on their hands, hand leaning, nail biting, and no one treats that and no one works on that,
Mhm.
of course that is not going to work. To do Maya for them, I see everyone, doesn't matter what they had done. Why? Because again, I start with their nervous system and I start with certain myofunctional therapy exercises. The only thing is that they you cannot do myofascial release on them.
Mhm.
And it's usually because I took a lymphatic course from my lymphatic massage therapist. Which, oh my god, I love her. But she said it was 4 weeks, 3 to 4 weeks that you cannot do massage, you cannot do myofascial massage on it.
Okay.
But it doesn't mean that you cannot do myo, because we teach them exercises that can do the exercises. Because
Right.
what we want to do, and I have a lot of cases where they just had Botox and they call me, be like, well, I just had it. Can I start? I'm like, of course you have to start, because what my job is, you out of pain, so I can work on
Mhm.
you and I can give you certain things to do. So when
Mhm.
it wears off slowly, the
Mhm.
pain doesn't come back. That's
Oh, I love
that's
that.
the thing, because if they're not feeling that pain, you're going to be able to do certain exercises without
Right.
triggering the pain. Because the
Right.
biggest fear we have as a therapist is like, I give them this myo exercises and they will call me and be like, oh my God, I'm in so much pain, like never again. Right.
Right.
So you you okay. That's
I
like a
love
good
that.
thing. Yeah.
Yeah, and
It's
I
just no
think
touch, no touch, and no warm compress. Like those
yep,
two things I would avoid, because you will, because there's liquid in there. They put like
yep.
things in. The other thing is what I've learned also with pregnant women. There's a trigeminal nerve comes from here. You cannot massage like next to the ear, so you have to be really careful with this points, because it
Interesting.
does something to the baby heart rate. Um, in
Interesting.
here too. So
Oh
to
my
here
gosh,
and
you are
here,
filled of like
yeah.
just so much information. I absolutely love it.
Yeah, because I give those exercises for trigeminal neuralgia patients, and I'm like, I just want to make sure people like don't do face point massages.
Yep.
For pregnancy, there's certain massages that can cause, and certain breathing exercises that can cause like an increased heart rate for the baby. So just be careful.
Vita, you're amazing. I just have to tell
Thank
you.
you.
So, I don't want to take too much more of your time because I know you're busy and you're getting your awesome appliance today, but tell where can somebody find you, whether it's a client or somebody that wants to take your TMJ course?
Okay, so for clients, they can find me on my Instagram, at myolavita, at myolavita, and for the website, it's myolavita.com, and I have all of the information about my program there. They can call me, they can schedule consultation over the website. I the My first thing is I see them for consultation first to see how I can help them and if they're ready to take my program. I
Mhm.
have a whole set program that I go through with all my cases, and I have a very high success rate because
Mhm.
they follow my program and they listen to what I give them.
Mhm.
And I know it works because again, I've tried it so many times, difficult cases. I had
Mhm.
cases who were bedridden, EDS, MCAS, POTS cases that I got them out of bed. So
Wow.
there's just so much that I work on. So it's just the person has to be committed and do the work because it's not me. I'm the guide.
Right.
I'm just
Right.
guiding them and teaching them what is the right thing. And I also refer them to the people that I like.
Mhm.
When I do referrals, if it's a complicated case like a TMD, trigeminal neuralgia, or EDS cases, I call
Mhm.
the offices and I screen the offices before I give the number to the patient. Because
Wow.
again, think about the trauma. If that person goes to that office and does that initial visit, and that doctor keeps labeling them and telling them there's something wrong, the pain is going to go from 4 that I got them from 10 to 4 back to 10 because
Right.
they will think that the body failed. The body didn't fail. The
Mhm.
body is not failing anyone. Those are
Mhm.
just symptoms. The body's talking through symptoms because the body doesn't have is unable to send you a message or text message. The symptoms is the text message. You're like, you need to look at this, you need to look at this. And this is how you heal yourself. Because if I was able to do it, anyone could do it. I was my most complicated case I had. And if I was able to help myself, that's the goal. For students, so again, same website, myolavita.com. It has a TMJD course on it. It has all preview in it. I have 19 modules. They're intense
Wow.
19 modules. I didn't even realize I've done so much until I like finished the course, but each module is about 1 to 2 hours. Some of them even
Wow.
have more. I give everything I learned in 15 years of my research that I've
Wow.
done for the jaw and for the overall body. I'm also adding imaging module because a lot of my students are not understanding what I'm seeing on the
Yeah.
images, and I'm trying to teach them that. So I'm working on that. I also have a community where they ask questions and I answer them every day. We have live Q&A 2 times a month, as well as one Q&A that is not recorded and we just talk about anything they want. And
Mhm.
then also what I recently added is all of the groups can join the live Zoom calls that I will keep
Oh, I love that, like, continued. Yeah.
continue joining, because what I realized that they always have cases to discuss, they always have questions. I will give priority to the group that is active
Mhm.
that
Mhm.
time, but a lot of times they don't have questions. So I
Right.
can I can let someone else to
And
ask.
that's even more learning for the ones that are just
Yes.
taking the course to hear what, past students who are now actively treating patients and how I think that's incredible
Yeah.
because it's one
Yes.
thing to take a course, but it's another thing to then like put it into clinical practice,
Yes,
right?
integrating. They need to integrate it. That's why I'm using community, because if I get a case and I get like a lot of complicated cases, I just send an X-ray and I was like, please read it for me. What's wrong with this X-ray?
Yeah.
And they like
Yeah.
write me comments and I'm like, look deep, look deep, look deep. And
I
I was
love
like,
it.
there's something else. And they're like, oh my God, there's the Eagle syndrome. I'm like, thank you.
I love it. Oh my gosh, Vita. I think I told you this, but your course is definitely on my list to take. Once these little chicks turn 1 and I can get back to, being a little bit more in my profession and in my career, I definitely want to take your course. I am so excited for you. I'm so excited for anybody that comes in contact with you, whether it's a client or a myofunctional therapist. What you're doing is truly amazing. We're gonna have to have you back because like we
Yeah.
got to question one. We got to question one on all those questions that I sent you. We taught which this information was phenomenal, but there's just so much more that you have to give. And I thank you so much for your just passion and your dedication and your openness. I mean, it's truly incredible the work you're doing. So thank you.
Thank you. Thank you so much for having me. Oh my God, I'm so excited. Thank you, Brittany. Thank you.
Absolutely.